Your outpatient nurse asks you if you could see a patient seen by the registrar who would like to see a consultant and he's not happy with the registrar. The nurse also tells you that this is not the first time it has happened. What would you do? Such occurrence is uncommon, but if it happens repeatedly, it needs further exploration. It could stem from registrars not matching the skill set required for the clinic or given work that's beyond training level. For example, a first-year registrar is doing complex post-operative clinics and feels out of depth at some point during consultation. Patient can feel frustrated as they feel that they are not getting the expert care. Sometimes patients want to see a consultant and not the junior doctor. As always, it's important in such situations to ensure that patients' interests are kept foremost. No harm comes to that, while supporting the doctor concerned to maintain confidence and team working. It's important in such scenarios to avoid leaving trainees unsupported to struggle on their own. A systematic approach using INSIST framework will make your narrative complete and you won't skip crucial points.
In this situation, when I'm informed that a patient is refusing to see my registrar, and this is not the first time, I would like to know what has happened in the past. I shall ask the clinic nurse, patient, and other consultant colleagues. I would also try to find out the reasons that the patient refuses to see the registrar. Is it because they're not satisfied because of the registrar's attitude problem, ineffective communication, or lack of knowledge regarding the subject? I would check whether we know how many times it has happened with other patients and whether we have informed any previous team members. I would try to find out whether concerns have been raised by any other nurses, whether any of the nurses or any team members were present during the consultations, and what they thought about his consultation style, knowledge and skills while dealing with patients. I would find whether patient care was compromised during this consultation or as a result of whether his behavior and attitude is impacting the patient care, as well as causing disharmony amongst other team members. I would speak to the concerned registrar to see what exactly is happening while dealing with patients. Has he done unsupervised clinics before? I will try to find out why he's not able to build rapport with patient while consultation, and has anyone brought this to his notice before? I would find out that he is not going through stress or any drug, alcohol problem which could affect his communication skills. I would also check whether he has attended any workshops on dealing with difficult and challenging patients. I would check when he has his multi-source feedback and was any concern raised about his overall practice. I would also look at his training record if possible, if I'm the educational supervisor, and check that he's attending regular training days and using study leave effectively. I will ask if he's happy for me to see the patient. I will offer if he would like to attend some supervised clinic with me so he's more confident in dealing with complex patients. I will also advise to consider some workshop around communication skills and how to manage difficult patients. I would also monitor, and if the problem recurs or if I discover concerning behavior during initial investigation, it needs to be documented in the appraisal portfolio and reflect them accordingly. I will inform educational supervisor and look for means to support this registrar.
Good response that explores causes and effect on patients and individual. It does not show a knee-jerk response. It respects the autonomy of the registrar and looks at reasons rather than jumping to conclusion. It looks at the scope of the registrar's training days, level of training, number of study leaves taken, and escalate as needed, giving opportunity to improve for the registrar and reflect.